Thank you for allowing me to speak. This board should be following the guidance of experts just like it did last year, but it's not. The Delta variant is real and it is affecting Alabama children. This week, Alabama set a record for the number of children hospitalized with COVID. Just over a week ago, a 13-year-old in Mississippi died from COVID. A high schooler in Coleman died last week from COVID. A record 1,900 children were hospitalized with COVID in the U.S. as of last weekend. 1,900. On Saturday, the Wall Street Journal had an article with a headline that said, "More children are hospitalized with COVID-19 and doctors fear it will get worse." I would encourage this board to take a look at that article. Delta is different. Things have changed. And even though a decision by this board in May of 2021 to require universal masking might have seemed reasonable at the time, it is no longer reasonable. And it is getting less reasonable, less rational, and less defensible by the day. We know that masks work to reduce the spread, and we know that masks work to slow transmission in schools. Ample studies demonstrate this. And this board and its superintendent said as much to us last school year. Are masks perfect? No. Are seatbelts perfect? No. Do speed limits prevent all car crashes? No. But we implement plans and policies and laws to reduce risk, not to take all the risk away. That brings me to this question. When did this board stop listening to the experts and to our doctors? The answer to this is simple: this school year. The board listened to experts in 2020 when a less contagious variant was disrupting daily life. And in fact, the 2020-2021 reopening plan required universal masking. And it said it was relying on the guidance of experts and physicians, many of the same experts and physicians that we're asking you to rely on here today. In August of 2020, our school board decided to require universal masking in schools for the 2020-2021 school year. And as a result, we kept our schools open the entire year. On August 12, 2020, a week after this board updated its policy for the 2020-2021 school year, the city council liaison to this board publicly posted and in fact took the effort to personally transcribe Dr. Caitlin Rivers, an expert from Johns Hopkins School of Public Health, and her testimony before the House on August 6, 2020. This testimony clearly demonstrated the efficacy of universal masking and other mitigation efforts. In a March 29, 2021 YouTube video, Dr. Freeman pointed out that one of the reasons we were successful in keeping the children in school and safe last year was because of universal masking. He said this: "As we move into the final 2 months of school, our focus remains on learning in a safe and healthy environment. Accordingly, we will continue to observe the enhanced safety procedures and precautions that have allowed us to operate successfully this year. Specifically, that means we will continue to wear face coverings and masks for the remainder of the year while indoors." What changed? The science has not changed. Reliable and credible experts and physicians still agree that masks reduce the spread of COVID. The virus did not become less contagious. In fact, it became more contagious. This board simply lost its courage to lead on a divided issue. This board became afraid of loud factions motivated by politics. The health and safety of our children is just too important. It cannot be motivated by politics. It must be guided by the best practices recommended by medical experts and public health officials. In conclusion, here is what concerned parents in Vestavia want from this board. Fully implement the best practices for mitigating the spread of COVID, as recommended by the CDC, the Alabama Department of Public Health, the Jefferson County Department of Health, the American Academy of Pediatrics, and countless other medical experts. This includes requiring universal masking in schools and other mitigation strategies. Moreover, we ask that this school system require accurate reporting from parents. The data dashboard is only as good as the data reported to the school, and it must be encouraged that accurate reporting is required. Number two, provide more transparent data. We need student absent numbers, not just those absent because of a reported positive COVID case. Number three, and finally, actively consult with experts and physicians from right here in Vestavia that have taken the time from caring for patients on the front line of this fight to reach out to this board and offer assistance in interpreting guidance and data. Thank you.
Thank you, Brian. All right, next, Stephen.
Ladies and gentlemen, Stephen Cohern, 1833 Montclair Drive. Thank you for the opportunity to speak to you today, and thank you for your service, because I know that you are good people, because no one agrees to serve on a school board unless they care about their community. And while I do not doubt your character, I must speak out today, because I believe the board's handling of its health and wellness plan threatens the safety of our children and teachers, as well as the community's trust in its public health system and its government. I've shared by email, telephone, and in person many of the specific reasons I believe the board's health and wellness plan is incomplete. Today, however, I want to talk about trust. As a child, I learned that I should trust police officers, firefighters, and doctors. But over the past year, many in our nation have viciously attacked our frontline doctors and our public health professionals, the ones who are working to keep us safe. They've been called liars, they've been called Nazis, and they've had their years of training and experience rejected in favor of Facebook misinformation. I sincerely want to believe that you stand behind our public health system, but the board's actions have left me questioning that belief, and the reason is simple. Numerous public health professionals from right here in Birmingham, such as Dr. David Kimberlin, Dr. Michael Sagg, Dr. Mark Wilson, and Dr. Ellen Eaton, have all said in very clear language that universal masking slows the spread of COVID-19, and that schools should adopt universal masking as well as other mitigation measures. At least, they say, this should be done until the current surge of cases is under control, not forever, but just until we can get things under control. These are some of the best doctors in the world, and they are saying the same things. So how does it look when the health and wellness plan declines to adopt their recommendations? Well, not to put too fine a point on it, but it looks like you are not following their advice. Some will see this and think that they also do not need to listen to our public health professionals. I don't want that. Some will see this and think the school board has rejected science and is sacrificing our kids' safety in order to further a political agenda. I don't want that. What I do want is a community where citizens come together to sacrifice for the common good, where selflessness triumphs over selfishness, and where children learn without limits. And I have to believe that each of you wants the same exact thing. But it's not enough for you to say that's what you want. It's not enough for you to just say that you're taking COVID-19 seriously. We, our community, need you to show us that you are. And we have seen a few things, changed lunchroom schedules, for example, but we are still largely in the dark about the things the board is doing to keep our kids safe. And I thank you, Dr. Freeman, for your report. I wish those things had been said 2 weeks ago. I have to say that when it's dark, people assume the worst. And so I think it's important that we bring some light to the situation. Some suggestions I have are to show more encouragement. You say in your plan that masks are strongly encouraged, so encourage. Put up posters asking students to wear masks and showing them how to do it correctly so that it's effective. Be more transparent. If we're here in this gym because we don't want all of us to be in a small room together, say that. Make a video. Let parents see and hear you saying these things that are so important to our school's success. None of these suggestions require you to change anything about the current plan, but they would show doubting parents the board is serious about COVID and that they need to take it seriously. And it would show concerned parents that you don't secretly believe that our public health professionals are fascist dictators, and that the health and wellness plan is not just lip service. If you do nothing, you risk undermining our community's faith in the public health system and our community's faith in the school board. This will deeply and perhaps irreparably scar our community long after COVID is gone. Today, we need you to be the force that brings us together. I need you to be that force. Our community needs you to be that force. Our kids are counting on you to bring us together. Do not let us down.
Thank you, Stephen. All right, Watts, I'll let you say your last name. I don't want to butcher it, so.
Okay, you did great with it last month. Watts, Olchey, 1548 Panorama Drive.
Thank you.
And before I start, I do want to hand this is the this is the you've got this digital form already. This is the response from the cumulative response from the doctors. I just wanted to make sure you had it in the easier read format. It's got some sections in it to help you. I've got one for council too, please.
Thank you.
So, it's been almost a month, and I'm standing here before you again. I've learned a lot over the past month. I've met a lot of amazing people. I'm also tired. So while I'd love to debate science and data with you, today I only have the energy to discuss something very personal to me. And that subject is the subject of bullying. I know bullying in schools is always a concern, and I'm confident that you take it seriously. Earlier today, I sent an email to Dr. Freeman. I don't know if you had a chance to read it, but I called out some particularly egregious examples, both physical and otherwise, that are currently ongoing in several of our schools, directed at students who are wearing masks. I'm available to discuss the specifics of these cases one-on-one with you, but I don't think this is the forum to call out details because the children are involved. I've given you some details. I've been bullied in grade school and otherwise, and I'm not ashamed to say so because it wasn't my fault. I'll admit at the time, it was embarrassing and demoralizing. But luckily I had some really fortunate influences in my life. My mother in particular. She's a strong woman. She was also my school's guidance counselor. She taught me that being a bully was a learned behavior. And oftentimes, it starts with parents. Unfortunately, some things never change. She and my father nurtured me, helping me find my own self-worth and explain that people are scared of those who are different, but even more scared of those who are independent. My children are resilient. I've tried to reinforce their sense of individuality and give them confidence to be themselves. They know I've got their backs. The fact I'm standing here today is proof. My children are lucky. There are many in this community that don't have the ability to stand up. Now is the time to support them. It starts with leading and actively suppressing division and promoting understanding. The great mask debate of 2021 has spilled out into our community and is dividing it. I don't expect you to lead the city, but I do expect you to recognize that our school system is one of the anchoring aspects of this community. While the Board of Education has published strong encouragement of face masks on its website, the lack of signage affirming mask use while optional, and the guidance of the faculty not to police mask use in children whose parents desire it, leads to a culture of division. The mission of our schools, ensuring each student has the opportunity to learn without limits, hinges on the active promotion of the following items, and you have come up with these items. 1, your first point, a safe and nurturing environment. And one that's a little bit less obvious is appreciation of diversity. The first item's clear. The second item, I like to think appreciation of diversity is not just constrained to race, but also diversity of opinion. I know the board is making decisions based on what they think is best. I do. But the simple fact is, children are being bullied right now when they're just trying to be safe or just trying to do what their parents told them to do. And while this may be an unintentional consequence, it's still unacceptable. I do want to say thank you for what you've done so far, okay? I don't want to sound unappreciative. There have been several policies that you've instituted that we've asked for, and you've listened, and you've delivered. So I want each of you to know that I appreciate what you've done so far. I don't want to be here next month. But until I feel safety, I will continue. And just to close, sometimes when grown-ups fail us, children kind of are more able to capture the meaning in things. And I was thumbing through last year's school yearbook. I'm gonna paraphrase this because it's got some names in it. But this was a quote from a kindergartner. "Sometimes I get tired of my mask, but my teacher says it's her job to keep us safe and our job to help her keep us safe." I think our masks keep us all safe. Thank you.
Thank you, Watts. Okay, next, Jen Vacris. I do want to remind everybody we need to keep comments to 5 minutes. Mr. Boone is graciously keeping time for us, so if you hear a tap of the gavel, that means it's been 5 minutes.
I've timed it, so hopefully we're good.
That's not aimed directly at you.
Oh.
So this will, all right,
Just happened to say it when I'm up here. I'm just kidding.
Well.
Kidding. My name is Jennifer Vacris. I'm at 3238 Wisteria, and I've got a third grader. Thank you, Dr. Freeman, and all of our board members for having all of us. We stand with you in this fight for freedom of choice. The board's decision was correct then, and it is correct now. I have a big risk factor for COVID, but I am not fearful. At the core of the situation is not a virus, but the freedom of men and women to make their own choices regarding their health and the health of their children. A small but very loud and combative contingency of our community wants to force parents to mask healthy children who are least vulnerable to the virus, least able to properly wear a mask, most detrimentally affected by not being able to see the facial expressions of teachers and students, most detrimentally affected by not being able to clearly hear their teachers and fellow students pronounce words, and most detrimentally affected by the inability to see social cues. It is the school's job to teach our children, and that's it. They are not in charge of their health. For the first full week in school, Vestavia's numbers with mask optional were 0.8% out of school, and none reported infected from school. While Mountain Brook and Hoover, who mandated masks, have more school-age children than us, were at 1.8 and 1.04 respectively out of school. Those numbers stand on their own, and I could end right there. However, it's necessary to remember that any study done on the effectiveness of masks is going to show them and study them being worn properly. This is not a real-life scenario among children or adults, so these observations can't be counted as fact and must be disregarded, as grown adults don't even wear a mask correctly, much less 19 children in a classroom. In addition, school isn't the only contact point for COVID, and I can provide pictures of children whose parents are yelling about masks in school, but allowing them to play sports, take trips, and play with other children with no mask on. It is useless, unnecessary, absolutely un-American, and wholly unrealistic to ask children who are still learning how to sit still to be able to keep a properly fitted mask on their sweet little faces all day. A local cardiologist and chief of staff says that a properly fitted N95 might protect against some viruses, but no one in the general public is walking around with a properly fitted N95. We go through an extensive fitting process for these, and they're expected to be changed every few hours as they're single use only. In addition, cloth and surgical masks are useless in stopping viruses because the particles are microscopic and pass through the weaving both ways. More importantly, surgical masks are to be used in a sterile operating room during surgery and with medical personnel who help change the masks if needed, and they know not to touch them before, during, and after surgery. And even then, they are only to be used to prevent bodily fluids from getting into and out of the sterile surgical field. And all of this fear for a virus with a nearly perfect recovery rate at more than 98% per the CDC, and for children who have a 3 to 4 times higher likelihood of contracting the flu than COVID. We've never masked for the flu, but the flu has killed more children than COVID per the CDC. Only 10 to 15% of children are wearing masks in school, so the overwhelming majority of parents in Vestavia are obviously not fearful. Those who are scared about being in public and feel that a mask can help stop a virus should be able to do so, but feelings cannot be mandated. If their choice is to buy N95s and have them properly fitted by a doctor at a hospital and not touch them at all once they're on their face and change them out every few hours, single use only, remember, then they should have the choice to do that. But how many adults are doing that? And how many of our children are wearing N95s and doing all the prior protocol? I can tell you that a sub at one of our schools says none. Quote, parents send their children to school in a mask and they're off, they're shared, they're on the floor, their hands are all over them and their faces, they don't wash their hands, and I have seen moldy and mildewed masks, end quote. Clearly, this is not about health. A group of parents much like us in Gainesville sent 6 of their children's masks to the University of Florida for analysis. Of the 6, none were found to have viruses on them. What was found, however, was masks. On the masks were bacteria, parasites, fungi, strep, tuberculosis, meningitis, encephalitis, antibiotic-resistant pneumonia, and staph. And that's what you want our children rebreathing all day? This is real life, real world proof in a climate much like ours that masks on anyone are not a prophylactic, but they are a false sense of protection and honor. They are a security blanket to make some adult somewhere feel better about a virus they can't control. And they are a warm, moist place for bacteria to grow. Since the medical community is so divided on this and not even close to unanimous, the decision rests with the parents. When that baby was born, he wasn't laid on the breasts of the government or the hospital or the CDC. He was laid on the breast of the parent. Their arguments are long and on emotion, but short on logic, bullying and shaming anyone who dares to oppose them into thinking that not catching COVID is the only point of our society's existence and daily life, regardless of any other long-term effects or damage to our children. And by the way, bullying goes both ways. Children need fresh air to breathe, but they also need germs and uncomfortable viruses to help bolster their immune systems. Yes, sickness is uncomfortable, but it's necessary that God's gift of an immune system must not be squelched so that they can develop antibodies to fight illnesses that will come their way. Again, we're not asking for no masks. We're asking for the continued choice as parents to care for our children as we see fit, not as somebody feels we should. We are not anti-science, we are anti-political science, we are anti-junk science. 2,380 deaths per day, scary. 271 deaths out of every 100,000 people, scary. A death out of every 36 seconds, super scary, right? Sound like COVID stats? They're not. That's heart disease stats. Thank you, Board of Education.
Okay, folks. I've got it, sir. Thank you, Jen. Next up, Claudette Poole. Okay, again, I want to remind everybody to please refrain from clapping or booing or anything else, please. Let's respect the speakers.
Hi, good afternoon, Dr. Friedman and the Board of Education. My name is Claudette Poole. I live in 4444 Galen Cove. I am a pediatric infectious disease physician. I work here in Birmingham. I also oversee infection prevention, and I have a master's in public health and epidemiology. I've been taking care of children with COVID since the start of this pandemic. I've been having to follow the science and the literature and the guidance to come up with recommendations. I am not here today as an advocate for my own children who attend the school. Go Rebels, they're playing both volleyball and football tonight, but really to advocate on behalf of all the children who will get sick from this virus before this pandemic is over. I was asked to come speak today, I have to confess reluctantly, in response to the health and wellness plan. It is often cited that COVID is not dangerous to children, and this is true when we compare it to older adults. Children, by definition, should not be hospitalized and should not be dying. I don't want it to obscure the fact that COVID is causing severe disease in our children. For the last month, we have had a steady flow of children in Children's Hospital admitted for COVID, many of whom are being taken care of in the ICU. We are very good at what we do, and thankfully most of these children go home. And a week ago, I would have said they all go home, but we lost our first patient last week, and this was a young boy, well not a young boy, a young man, who was attending school the week prior to coming into the hospital. I am fielding multiple calls every day from providers looking for my assistance to help them get monoclonal antibodies to treat their high-risk patients. And I want to remind everyone these high-risk conditions in children are actually very common. It includes things like asthma, diabetes, and being overweight. Not to mention all the children living in our community who are fighting cancer and living with chronic health conditions. Since the start of this pandemic, we have treated over 100 children with a very serious COVID-related condition known as MIS-C. And as this community outbreak is increasing, we're seeing more of these children come to the hospital desperately ill. We have more and more pregnant women being admitted to the hospital, to the ICU, many of whom are having their babies delivered prematurely as these moms are being placed on ECMO and are dying. As this awful pandemic is unfolding, we have multiple organizations whose sole purpose is to enlist the help of career professionals who have both the expertise and training to comb through all the data, to review all the literature, both the published and the unpublished, to have lengthy debates, and then to publish guidelines. These organizations include the Center for Disease Control and Prevention, the American Academy of Pediatrics, the Infectious Disease Society of America, our health department. And after these guidelines are published, they're made available for all the other organizations who have to draft policies, such as hospitals, long-term care facilities, places of work, daycares, and schools. Children's of Alabama just issued today strong recommendations in response to what's happening locally in our community. They strongly recommend the following to help keep our children safe from the spread of the virus as they return to school and school activities. Masking for students in the in-person school setting, regardless of vaccination status. All others, especially unvaccinated adults, should wear masks inside buildings at all times, especially around children under 12 years of age who are not eligible for vaccinations. Full vaccination for those who are 12 and older. avoiding large crowds and socially distancing to the extent possible, hand washing and or use of hand sanitizer. Dr. Friedman has released the numbers of children who are being kept home due to COVID diagnosis, and I just want to remind everyone, this is in the context of an absent statewide mask mandate, limited density reduction in schools, and the Delta variant that is 2 to 3 times more transmissible. And this really does have the potential for a very rapid and large outbreak amongst our school-aged children. The current wellness plan is out of alignment with the recommendations that have been published by all our trusted health organizations, including now Children's of Alabama. And as a consequence, the burden of proof is on you to justify why. And that's why I think there's so many people here for public comment. Myself and my colleagues who are taking care of these children are urging the board to reconsider disregarding these recommendations and bring them back into alignment. Thank you.
Thank you, Claudette. If you need to leave early, you can, but bring home 2 victories for us, okay? Okay, next up is Monica Carroll.
Hi there, my name is Monica Carroll. I live at 2657 Best Club Circle. If y'all will, please excuse me for reading my remarks. I tried it a couple of ways, and the fastest way through is for me to read, I promise. I want to start by thanking the school board for providing a forum in which we as parents can voice our concerns. While I don't personally know everyone who's here today, or even everybody who's on the list to speak, I feel certain that I can say that we're all here for one common reason, and that's because we love our children. As parents, we all strive every single day to make the best choices for their immediate safety and their long-term well-being. Similarly, we've all been driven here by some degree of fear, whether that's the fear of a virus or the fear of the long-term effects of universal masking. The issue, for whatever reason, is extremely divisive. We're at each other's throats over it, and we are free to disagree, but we are not enemies. We're not. When we boil it all down, we are 100% united in our primary objective, which is to protect our children. As parents, we have both the responsibility and the right to direct our own children's education, care, and health. The right to make those choices is an inherent consequence of the parent-child relationship. In fact, this country and its courts have long recognized that to be a fundamental right of parents, a fundamental right of parents. And that right does not end at the schoolhouse doors. Before I go too much further, I want to take a minute to dispel a myth. Those of us who are here to advocate for optional masking are not anti-science. We're not even anti-mask. There's not a single person here who is advocating for the prohibition of masks or for the prohibition of other protective gear that parents might choose to send their children to school with. We stand for freedom. I also want to dispel another growing myth. A medical degree is not a prerequisite to parenting. Those of us without those letters following our names are no less able to make wise, educated decisions for our families. We can read, we can research, and we've done all those things. In the course of doing those things, we've learned that the value of masks is, at best, uncertain. For every journal article you find that touts the efficacy and importance of masks, you can find at least one that says the complete opposite. In fact, through our countless hours spent reading and researching, we've also observed that most articles that pre-existed the politicization of the virus say that masks are not effective at preventing its transmission. Our neighbors who are here demanding that this board institute a mask mandate are passionate. Those of us who believe such a mandate would be an abuse of power are no less passionate. We'll continue to stand for freedom for as long as it takes. As parents, we've seen our children struggle unnecessarily through a year of mask mandates. We've seen our children fall behind academically. We've seen our children become more anxious. We've seen our children become more depressed. We've seen our children withdraw socially and emotionally. We are the people who've seen the negative effects of mask mandates on our children. If you want to discuss bullying over the mask context, we should also talk about the people who are telling our children that they're killing other people by their not wearing a mask. We are the people who are best equipped to choose how to safeguard our children's well-being. Why any parent would seek to infringe on the fundamental rights of another parent is beyond me. Our local and statewide health officers have put this board in a terrible position. They've opted not to issue mask mandates, like they did in 2020, which is why the school had mask mandates. They've made that choice either because they know they're not beneficial, or because they know that the general public recognizes that for what it is, a gross abuse of power. In the end, those people really want to keep their powerful jobs, so they chose instead to twist the arms of every single school board in this state into doing their dirty work. As a parent, I don't envy your position, but I'm so grateful that you are my child's school board and that you recognize the fundamental right of all parents to choose how to best protect their own children. Thank you.
Thank you for your comments, Monica. Christopher Harris.
Thank you. My name is Chris Harris. I reside at 4029 Riverview Drive. I'm a Vestavia alum. Dr. Freeman, I would like to express my appreciation to you and the board. To start the school year, you made a decision about masks that made almost everybody happy. Your decision let each family have a choice of what was best for them. If a student lives with an at-risk person or just feels safer at home or wants to learn virtually, they can. If a student wants the school experience yet feels safer wearing a mask, they can. And if a student would rather come to school the same as all of us did, without a mask, they can. After finding out that only 5% of the high schoolers are wearing masks, this tells me that your team got it right. It also tells me that the overwhelming majority of Vestavia parents agree with your decision to give us choices. So please don't feel pressured by the few. They have the same choices as all of us. Again, thanks for your leadership.
Thank you, Christopher. Elizabeth Swords.
My name is Elizabeth Swords, and I live at 1364 Willoughby Road. Thank you for allowing me to speak today. I am speaking in support of the current mask optional decision. I want to make 3 points that support this option. First, we need to provide protection for our children in all things, not just viruses. Second, we need to foster an environment for our children to be successful. And third, as parents, we need to keep the right to choose what is best for our children. As a parent, my children are some of the ones who are impacted negatively by being forced to wear a mask every day. For us, virtual school was not an option because being isolated at home created worse issues for them. So going to school with a mask was the lesser of two evils. As parents, our job is to protect our children. Protecting them does not just include protection from viruses, it also includes intellectual, social, and emotional health. Only a parent knows how putting a mask on their child will affect them in those areas, which is why I appreciate the board recognizing the importance of the health of the whole child and preserving a parent's right to choose. As an educator who has taught elementary students with all kinds of needs and backgrounds, I know firsthand how difficult it can be for children to make friends, connect with others, learn new things, and focus inside a classroom. These children are still developing, learning discernment, how to communicate, and read facial expressions. If a child has to wear a mask, it makes everything they do much harder, more distracting, and more stressful. As a teacher, it is imperative to be able to see your students' faces so you know if they are having a good or a bad day, because not all students will tell you. If you haven't taught or had a child who struggles in one or more of those areas, you probably don't realize how difficult things can be for these precious children. Thank you for fostering an environment that allows all students to be successful by preserving a parent's right to choose. To be clear, I am not anti-mask. I am just in favor for deciding what is best for my children. From conversations with my peers, many children did not have issues with wearing masks last year. However, Many children did, with complaints such as daily headaches, almost passing out during PE, increased anxiety, depression, and other emotions. These are issues that cannot just disappear by trying to normalize mask wearing. These issues are why mandated masks are not okay. Parents know best on how their children are impacted by masks. This is also why parents across the country are so driven to eliminate mask mandates for school-age children. Luckily for the parents in our community, the board has allowed us the freedom to choose. You have put an educated, well-thought-out plan in place that creates a safe and clean environment for all children. You have allowed parents to send their children to school in a mask in order to protect them. And you have allowed parents to opt out of sending their children in a mask in order to protect them. By not forcing mandates on us, you have recognized that each child's situations and needs are different, and there is not a one-size-fits-all approach. Thank you for being strong leaders and making a difficult decision on what is best for all families in the Vestavia Hills school system. Thank you for doing the hard thing, the right thing, by not taking our freedom and parental rights away. Thank you for allowing us to choose what is best for our children and families. I, as well as many others, stand by your decision and support you. Thank you.
Thank you, Elizabeth. Noah Lewis. Is there a Noah Lewis? Okay. Josh Boyd.
Josh Boyd, 1501 Pump House Court. I want to thank the board, Dr. Freeman, all the members for your courage to lead. This is not about masks. It's not. It's about the virulency of COVID. Our kids are at less risk from COVID than they are the flu. At no point in the past has COVID, at no point in the past has flu caused more or less hospitalizations or less deaths than COVID. Kat, can you bring those binders up for me and pass them out to the board? Sorry, I forgot my binders for you. If you could just pause my time. So I have an extra one if everybody wants to look, but if you look at Exhibit A, if you open it up, this is the rate of COVID per 100,000 in the population. This is from the CDC's own website for the under 18 cohort. If you look at Exhibit B, this is the rate of the flu under 18 years old from 2018 to 2019. If you look at Exhibit C, this is the rate of H1N1, the last pandemic we went through, for under 18 in 2019. At no point in 85 weeks has hospitalizations for COVID exceeded the rate of the flu. What's interesting about Exhibit A is it shows per 100,000 that Delta is not hospitalizing more kids now than Alpha. We are being propagandized. This brings me to Exhibit D. If you look at Exhibit D, this is a release in Sweden's pediatric journal. Delta has been in Sweden since April. And what it states is, if you look at the second page, let me read it so everybody can see it here. Bear with me, I don't have a table. Adolescents over 12 years of age who want to optimally protect themselves against the frequent benign COVID disease, rare long COVID complaints, and the very severe PIMS, recommends the COVID vaccination. Adverse effects comparable. So far, children mainly have been infected in the family environment, transmission in school settings. Pediatrics also apply to highly contagious Delta variant, although concrete data are still missing to the end of summer holidays. Experience to date in children's hospitals pediatric practices indicates the number of cases in the fourth wave is increasing rapidly, but does not differ from previous variants in terms of severity and almost without exception cause benign flu-like clinical cases in kids. That is from Sweden. Also, if you look at Exhibit E, what is happening right now is a spike in RSV cases. Flu's timeline, and nobody wants to talk about that, sends 58,000 kids to the hospital every year. Flu's timeline is measured in roughly 28-week increments. COVID has been around for 85 weeks. If you take the 3 worst flu seasons since 2009, 3,184 kids have died. Okay, 3 flu seasons equal to 85 weeks of COVID. If you take the 3 mildest flu seasons since 2009, 1,263 kids have died. COVID-19 in the same time frame is the deaths is 364. So your kid is 8.7 times more likely to die in a worse flu season and 3.5 times more likely to die in the mildest season of the flu. This is with a vaccine, and your kid is more likely to die. Flu is more severe. RSV sends 58,000 kids under 5 to the hospital every year, no vaccine. It is an undisputed fact that for kids for the past 100 years, and based on this data, that they are more likely to be hospitalized and die from the flu than COVID. The burden of proof is not on anyone to get our kids out of masks. The burden of proof is on you to take us back to a standard that you didn't apply in previous flu seasons when the disease was more severe. If your kids had showed up to school with a mask on in 2018, the mask optional crowd would not have asked your kid and demanded your kid take off their mask because they're traumatizing and scaring my kid. Would not have happened. We would have respected your decision. Exhibit F is from a press conference from 2018. Before I get to that, in 2018, let me read you this press release from AL.com. Governor Kay Ivey has issued a state of health emergencies. The flu continues to ravage the state. Emergency departments and outpatient clinics are also seeing very high volumes of patients. Children's is on diversion protocol Thursday due to a bed shortage at the hospital. The hospital is requesting the Birmingham Regional Medical Services System to divert patients to another pediatric hospital due to bed shortages. Briarwood Christian is closed down. Several campuses of Randolph School and Huntsville are closed down. Not one person has been in front of this board in previous years and demanded our kids to wear masks. Not one medical expert, not one politician, not one parent. Exhibit F is a press conference from Dr. David Kiberlin from 2018. If you watch this, and you can link to it, if you watch it, and he states there are more kids, there are 30% of the hospital beds, roughly 15 beds, have flu patients in them. There are 12 with COVID now. During Dr. Kimberlin's comments in his press conference, he never once mentioned that kids need to wear masks. My simple question is, what are we doing here? The science on masks is not grounded. It's murky. I'm not going to argue with that. I don't think we can say that with certainty. I don't think anybody can sit there and say that masks are efficacious or not. We don't know because there's been no randomized clinical trial in kids in schools. What we do know is that they've never been mandated. And last year, the NIH spent $42 billion on medical grants. Not $1 went to studying kids in schools. The political science of this is what we do know. This was weaponized last year to win an election. It's continuing today to put fear and control into your heads and distill it down and leveraging our most important assets, which are our kids, for our greatest fear and to scare every one of you. It is a proven fact that in previous flu seasons, they were at more danger and we did not have this reaction. There has never been a board meeting like this. We need to come together as a community, as adults, and stand up to our kids. We need to buffer them from politicians and bureaucrats in DC. They need us now more than ever. We're the land of the free and the home of the brave, not the land of the control and home of the timid. I pray for every one of us. I pray for my kids, your kids, that they stay safe, just like I would in the flu season. And the members of this board and community, I pray for you. Thank you for your time.
Thank you, Josh. Joanna Cosby.
4754 Liberty Park Lane. Did you hear it? My name is Joanna Cosby. I'm a mother of 3. I'd first like to thank you, Dr. Freeman, and school board for protecting parental rights that include being able to choose what does or does not go on or in our children's bodies. It is so important for parents to retain authority over medical decisions that affect their children. It's natural that we are all going to have differing opinions on the safety of masking our children. So the only answer is you do what you determine is healthiest for your child and allow me to do what is healthiest for mine. What works for one child might be mentally, emotionally, or physically harmful for another. And where there is risk, there must be a choice. Some will argue that medical professionals wear masks every day with no adverse effects to their health. But Vestavia City Schools are not hospitals. The students of Vestavia City Schools are not medical professionals or adults. It is impossible, especially when at school, for children to keep a sterile, sanitary environment that is absolutely necessary for safe mask use. 29 CFR 1910.134 Appendix D from the U.S. Occupational Safety and Health Administration further attests to the importance of being professionally trained on the limitation, storage, and usage of masks to avoid hazard to the wearer. Environmental toxicologist and court-credentialed infectious disease experts Kristen Kelly and Stephen Petty assert that 99.9% of all COVID particles emitted from humans when breathing are aerosols, not droplets. The small amount of and what causes severe sickness with COVID are the aerosols, not the droplets. The small amount of droplets that the mask does catch then creates a warm, moist environment for all of the biologics to grow. They assert not only are most of the aerosols and droplets getting through the cloth masks, but what is trapped by the mask has high risk of doing harm to the wearer. This has led to many cases of bacterial infections in children, including my son. He missed weeks of school last year, not for COVID, but for a bacterial lung infection that started off as a simple sinus infection. It was indeed the warm, moist environment of his mask that created the perfect breeding ground for bacteria to quickly grow, despite me cleaning it daily. I have several friends whose children got similar infections from chronic mask wearing last year in and around their nose and mouth. My concern here is about the risks that come with putting a mask on the faces of our children. And where there is risk, there must be a choice. I'll end with this. The enemy seeks to divide us, but I pray as a community we will not allow it. I sincerely hope that we can respect one another's bodily autonomy and the health decisions that we make for our children. Thank you.
Thank you, Joanna. Lindsay Burks.
Dr. Freeman, board members. Thank you for giving me this opportunity to speak to you. My name is Lindsay Burks, and I'm the parent of a second grader in Vestavia Hills School System. I know that this has been a difficult start to the school year, and you've been faced with making decisions that you never thought you would have to make. The weight of this decision should not be put upon the education system, but our state has put this decision upon the local school boards. Alabama Department of Health follows the CDC guidelines to prevent and decrease the spread of COVID-19. These measures include vaccination for those 12 and older, universal masking, and distancing. Our local infectious disease experts at Children's and UAB recommend universal masking. Why are you so hesitant to follow the advice and make the decision to universal mask? For those my child's age, the vaccine is not an option. The only option are masking and distancing. My child is currently at a small table facing 3 other children who are unmasked. I've had the opportunity to discuss the situation with Ms. Weaver, and I'm grateful for her willingness to provide feedback from a school board member. Her reason for why the board has decided not to require masking is that why should they be masked during school hours if they are not the remainder of the time? For my family and many others, school poses the biggest risk for COVID exposure. We limit our indoor activities and mask indoors. We mask while in the office and in public to protect our child who does not have the opportunity to get the vaccine at this time. Ms. Weaver also stated they're constantly watching the numbers and comparing those to requiring masks, such as Mountain Brook and Homewood. I would like to remind you that those numbers represent children. I did not grant permission for my child to participate in a research study that would allow her to be in the control group with no intervention. Last week, an infectious disease expert stated that the Delta variant is infecting a greater number of children than ever before last week. Why wait until the numbers, or rather, the number of infected children continue to rise when a known intervention, such as universal masking, has been proven to be effective in reducing the spread of the COVID-19 virus? I urge you as the Board of Education to use medical science and prevention. While cases of the Delta variant may be unavoidable, we should take every precaution available to help protect our children while keeping them in school to learn. Thank you for your time and consideration.
Thank you, Lindsay. Riley Livingston.
Thank you to the board for allowing me to speak today. I'm a board certified MD, and I attained my master's degree in public health from UAB. After which I completed a 4-year residency in anatomic and clinical pathology, followed by another 3-year residency in pediatrics. I'm currently a board certified pediatrician, a mom of 2 children, one of which is a first grader at Belk, and also have a 14-month-old son. Despite the last 2 years and everything scary associated with it, the modern world isn't more dangerous than it was 34 years ago. Even though it feels this way, more accurately, instead of a more dangerous world than decades ago, we instead live our lives in a much more risk-averse way. For a variety of interesting and nuanced reasons, we tolerate risk, especially for our children, has slowly declined and steadily. Unfortunately, when we control for one set of risk, another risk simply arises in its place. In trying to prevent broken bones and bruises, we also inhibit our child's development of autonomy, competence, confidence, and resiliency. In treating many things as if they are extremely risky and therefore should always be avoided, we prevent kids from learning how to judge for themselves what is truly dangerous from something that is just simply unfamiliar. I started my own pediatric practice in January 2020. It's a small micro practice, and I currently have 142 enrolled patients. Previously, I had patient panels of 1,000 for many years. I completely removed myself from traditional medicine to practice medicine in a way that I wanted to. I felt the only way that I could provide this type of excellent care was to provide individualized medicine to all of my patients. As a pediatrician, I help guide parents and patients in making decisions about their own health care and assessing the risk and benefits of each of these decisions. Unlike the vast majority of the healthcare system, both locally here in Birmingham, statewide and nationally, children are denied access to health care, fired from the care of their pediatrician if parents do not consent to the following CDC recommended vaccination schedule for their child. This is a strong and very risky statement for someone like me in this city, but it's my professional opinion and personal opinion that is medically negligent for our healthcare system to deny medical care for children whose parents come to the conclusion that the risk of a medical procedure and intervention, such as vaccines, outweigh the benefits of their own individual children. Please take note, however, my children are fully vaccinated based on the recommended CDC schedule. Why would I, without hesitation or question, continue to provide medical care to a child whose parents decided to not follow my recommendations as their physician? Simply put, because it's their child. It's the parent's decision. I respect a parent's decision even if I don't agree with it or if I chose differently for my own children. This does not change my relationship with my parents or the parents of the child. My role as a pediatrician is to provide medical guidance and advice, but never to influence their decisions for their own children through coercion, force, or threats. Most find it shocking when I discuss the details and actual numbers with regards to the number of childhood vaccinations that we give children. I feel this is important to share with you because it closely parallels my professional opinion regarding masking our children and vaccinating our children against COVID. By the time a child is 6 months old, I have recommended, and in most instances, administered a total of 24 vaccines to that child by 6 months of age. By the first year of age, the total vaccines administered is 35. And by 4 years of age in Alabama, the total number of vaccines administered is 43 vaccines. That's a lot, but I still recommend that. Why do I recommend this for my patients and my own children? Because they are at severe risk of severe disease morbidity or death mortality without the gauntlet of vaccines that we give to infants and young children. Furthermore, ethically speaking, I believe the onus is on the proponents to show that the benefits of masking outweigh the cost or risk. They are proposing a fundamental, very risky shift in classroom interactions that they should have to prove with absolute certainty that there are no other options for safely attending in-person instruction in our schools. Today, that hasn't been proven. When the pandemic began, the lack of knowledge about COVID, I think most would agree, justified the extreme measures we endured as a society when we knew nothing about this novel virus. Those justifications and excuses are no longer valid and are not supported by the medical literature or the science at this time. Social distancing and masks hinder learning while harming children emotionally, socially, and physically, all for no purpose other than providing a false sense of comfort to the adults who ought to know better. Adults are supposed to ease the fears of their children, to reassure them that there's not monsters under their bed. Instead, we're frightening them into believing they're being stalked by some invisible menace through the air that they breathe. A year of mask wearing, I believe, has scarred many of our children psychologically. By hiding teachers' lips and muffling their voice, wearing masks makes it harder for young children to develop linguistic skills, and prevents children in noisy environments, like those in every classroom, and those children with hearing impairments like my niece, from lip reading. And able to rely on facial cues, students and children of all ages are more likely to interpret each other. A devastating problem for all children of any age, but particularly even more important, and a significant problem for children with autism spectrum. In particular, children lose the experience of mimicking expressions, an essential tool of nonverbal communication. Positive emotions, such as laughing and smiling, become difficult to recognize. Negative emotions can get falsely amplified or completely incorrectly interpreted. Bonding between teachers and students, which is essential to learning, has taken a massive hit. Overall, it is likely that masking exacerbates the chances that a child will become extremely anxious and depressed, which I personally have seen a dramatic increase of this with my patients, especially in the middle school and high school age group. This has already been at a basically pandemic level prior to COVID in both our middle school and and high school age children. How are children supposed to develop social skills when they can't see one another's faces, sit, or play together? The CDC advises that no child at the age of 2 years old should wear a mask, but that those older children should be required to wear a mask in certain situations like areas with widespread transmission, and only after consulting with parents after weighing the potential impact on their learning and psychological development. The CDC also outlines the effectiveness of masks and whether they are worn correctly and consistently. These caveats are ridiculous. Washing your hands or using hand sanitizer before putting on a mask and taking it off. Absolutely no one does that, not a single time, maybe once all day. Only touch the straps of the mask when you're putting the mask on or removing it. Never touch the mask, not at all. Adults can't even do this. Does anyone see any problems with any of the recommendations in a classroom that the CDC said is the only effective way to actually wear a mask? If you observed our children in the school last year for more than 5 seconds, which I did on multiple occasions, the effectiveness of wearing a mask in our children was abysmal if you rate it against what the CDC recommends effective. Pretending that our children, or adults for that matter, are dutifully performing all of these precautions is completely absurd. My comments by no means are meant to lessen or criticize the immense efforts of our teachers and staff. So why are we, as adults, insisting on masking our
Riley,
children?
I hate to cut you off, but you've reached the 5 minutes. I know you have other things you want to say. If you would like to give us a copy, I can make sure that the board has a copy of your notes.
Sure.
If you would like to do that. Thank you for your comments. Gilbert Perry.
Mr. Bendel, Dr. Freeman, members of the board, thank you for giving me the opportunity to speak today. I'm a cardiologist at UAB, director of clinical services there for cardiology, and also run the post-COVID clinic there. So I'm very familiar with what COVID can do. But I'm here today as a grandparent who has a 10-year-old daughter at Dolly Ridge who is not eligible for a vaccine. And I'm here to implore you to institute a mask mandate to protect my granddaughter and all the other children in our school system. I've lived in Vestavia 34 years, and I've always been impressed that we look out for our neighbors and for our children. It's part of what brought us here and kept us here. And I'm frankly saddened and confused as to why we are not implementing expert guidelines to protect our children. These are stressful and frightening times. Apparently, in the first 12 days of August, there were 6,000 children in Alabama now with COVID. That's more than 4 times the rate that we saw last year in a similar time period due to the very infectious Delta variant, which you've heard about. Last week, according to Alabama Department of Public Health, there were 50 children hospitalized throughout the state, including 9 on ventilators. And there are additional over 100 children with that severe multi-inflammatory syndrome you heard about from some of our pediatric experts, which is a truly horrible condition that we wouldn't wish on any of our children. According to the dashboard that just came out, there are 16 COVID positive children at the school where my granddaughter goes to, as well as another 33 at home as close contacts. And I'll point out that 16 is just what we know about. It's almost certainly the tip of the iceberg, and I guarantee you if we tested all those kids every day, we'd find out the rates are much higher. And why is that important? It's because we have a raging wildfire of COVID in the state. Our hospitals are packed. I can't accept transfers into our CCU anymore because our CCU is now a COVID unit. So I have people out all over the state dying of heart attacks and heart failure because I can't get them into our hospital. So I think it is, in times like this, we need to listen to our experts. What do our experts say? Well, you've heard from many of them here today. Our own Alabama Department of Public Health recommends universal masking to protect our children and also, importantly, to allow them to stay in school. So keep in mind that a close contact is defined as not wearing a mask. So for instance, let's say a child gets COVID in our classroom and that child is masked and every other child in the classroom is masked. You know what? It's not a close contact. They could all stay in school. Now what happens if one unmasked child comes in there, is infected with COVID, and every other kid is masked? Well, they're all close contacts. They were not both wearing masks. That is the definition of a close contact. It is really important to stop this, that we just mandate universal masking. So I strongly urge you to follow our expert guideline and do that. Thank you very much.
Thank you, Gilbert. Connie Goodman. Connie Goodman. All right, we'll move on to Ann Martha Corley.
Hi, I'm Ann Martha Corley, 2588 Mountain Woods Drive. Thank you, Dr. Freeman and board members, for allowing me this time. My husband and I have 2 daughters in the Vestavia school system. The oldest is 11. She's here at Fizitz in 6th grade. And our youngest, Ella Rose, is 8 in 3rd grade at Vestavia West. Some of you may know Ella Rose. She is a social, active, fearless, horseback riding, race running, musical, kind little girl. She also happens to be functionally blind. She reads Braille and walks with a cane. We cannot say enough about Vestavia schools. The principals, teachers, support staff, nurses, everyone. The school system is why we moved to Vestavia. You can imagine I have felt fear for her many times, but not like this. I have been fearful for the newness of situations and places. I have not ever been scared to send her to school. I'm terrified of the high positivity numbers, higher than this time last year, the rate of transmission and seriousness of infection in children who are unable to receive the vaccine yet. My fear is great for my older daughter also, but for Ella Rose, it's off the charts. You may not know this, but her vision impairment is the result of a viral infection that attacked her brain when she was 7 months old. The result is damage to her occipital lobe. We were so thankful that was all she suffered then. I have no idea what another viral attack would do to her. I do not wish our experience on anyone. Virtual school is not a valid alternative for a blind person, I hope for obvious reasons. We cannot send her to a private school since she would not receive services. So you see, we have no choice but to send her to school. Ask her to wear her mask and that those around her wear masks. I have no idea how many people are wearing masks around her and if she will be protected. I cannot be there to keep her safe, but I have to send her. I know that the teachers, staff, nurses, and principals are doing all they can to keep our children as safe as possible within the policy given to them. They are in an impossible situation. I'm asking you to reconsider your mask optional policy in favor of a mandatory mask rule, at least until children under 12 are able to receive the vaccine. I'm asking you to please consider the children and their families who cannot learn virtually or attend private schools, those who have no real choice but to send their children every day en masse and pray they will be okay. My stomach is in knots all day when I send my kids to school over fear for their health. I know I'm not alone. I know many families of special needs children who are in the same situation. Please consider them. Thank you for your time.
Thank you, Ann Martha. Susan Rathmel.
Good evening. I'm Susan Rathmel. I'm a clinical psychologist. I've been in practice in Birmingham for 14 years. I understand that in trying to do the best for for the children of Vestavia, you have considered a large amount of data, and along with it, a great many opinions. I can only imagine how hard these decisions are when you're making them for the health and well-being of children. But you don't have to bear that responsibility alone. Healthcare providers of all specialties rely on the expertise of public health officers and their teams who have very specific training as to how to protect the entire population while finding a way that minimizes the burden on the public. If you hear nothing else that I say today, please hear this. It is not fair of the public to expect you to write mitigation guidelines. That responsibility should fall to these public health experts. With Governor Ivey's endorsement, the Alabama Department of Public Health laid out what schools in Alabama should be doing, and they are the experts. So please follow what they have provided. If you truly care about your students, teachers, and staff, and I believe that you do, then please direct your principals and teachers to follow the ADPH's guidelines, including mandating masks, until those experts tell you that it's safe again. I understand that this board heavily considered a German paper published earlier this year in the International Journal of Environmental Research and Public Health when you were establishing COVID mitigation protocols. The alarming conclusions from this paper sound dangerous, as they mention masks causing a psychovegetative state in children. That's understandable, especially to a layperson. That sounds scary. However, experts easily identified several fatal flaws in the author's methodology. It's important to know that this paper is no longer considered legitimate in the scientific community. In fact, the entry for the abstract of this paper on psycharchives.org includes this disclaimer, quote, "We are of the opinion that this publication would not withstand the scientific review process undertaken by any reputable scientific journal," end quote. My advice as a mental health expert is that you disregard this German paper entirely. It is not good science. The good news is that there is very good science concerning face masks in children. And here is what that science tells us. First, the pandemic has had a considerable negative effect on the mental health of children. Here are the stressors correlated with decreased mental health in children: school closure, the death of a primary caregiver, increased abuse in socially isolated households, family economic loss, and lack of access to mental health treatment. What has not been legitimately demonstrated to have a negative effect on children's mental health is masking. Masks significantly, and using that word is a big deal in the scientific community, significantly decrease the transmission of COVID. All of the stressors I just mentioned are caused or worsened by closing schools. If keeping schools open is your primary objective, then masks are your answer. Masks do not affect facial recognition among children to any considerable degree. I'll add that these are not my opinions. These are the results of legitimate research, and I have citations that I'll give you in hard copy when I finish. Finally, children are able to understand social and emotional facial cues by watching the unmasked portion of their peers and teacher spaces. That's the science related specifically to COVID and pediatric mental health. But now let's talk about something bigger. Let's talk about doing the right thing, even when it's uncomfortable, even when it's unpopular, even when it means doing something that you really don't want to do. Let's talk about the importance of listening to the scientists who have devoted their lives to rigorous, legitimate study of infectious disease, and physicians who have devoted their lives to public health. Let's talk about the fact that the CDC, the American Academy of Pediatrics, and our own Alabama Department of Public Health, and just today, our own Children's of Alabama, have said to us that universal masking is their strong recommendation. Let's talk about the inherent vulnerability of children who depend fully on us for their protection. Let's talk about the realities of the Delta variant, which is sending kids to the hospital every day. As a clinical psychologist, here's what I think is happening to all of you right now. You see the numbers and you hear the experts every day. Deep down, I believe that you know that masks and rigorous mitigation protocols are what need to happen if you don't want outbreaks in your schools. But you also know that there will be repercussions for you personally if you order them. You don't want that responsibility hung around your neck. After all, you have to work and live in this town. I understand that, truly. This is awful and it's unfair. It's unfair to everybody and it's unfair to you. So you're hoping that even without masks, maybe nothing really bad will happen. And maybe it won't. But maybe, perhaps even probably, it will. And when it does, you're each going to have to reckon with your own selves. And that would be a very heavy burden. As a clinical psychologist, I can tell you that for as many patients as I treat for trauma who have intense fear and horror when they think about what they went through, by far the more common reactions are guilt and shame. Trust me when I say you do not want to live with that. What if a teacher dies? What if, God forbid, a student dies? Why on earth, in the face of this evil, ravaging Delta variant, would you take that risk? If you truly care about the children in your charge, you will mask everyone in your schools, even if they hate you for it. It will be uncomfortable and unpleasant, but you'll know that you did the right thing. Doing the right thing, even when it is unpopular, is courageous. It's leadership. I know you are all capable of doing that right thing. The last thing I'll say is, you don't have to do it alone. All you have to do is defer to the experts. It's not fair of us to expect you to make medical decisions. Let the experts bear that responsibility. All you have to do is follow the guidelines of the Alabama Department of Public Health. That's what they're there for. Thanks.
Thank you, Susan. Susan, if you would, I don't think we got your address when you began, so if you could, state your address for the record. 3464 Spring Valley Court. Okay, thank you. Okay. Nancy Toffel.
Thank you for letting me speak today. I do believe I'm the last speaker, so for all of you, this will be short and sweet, hopefully. I have 3 points I want to let you know about. First, my name is Dr. Nancy Toffel, and I'm a professor of pediatrics at Children's of Alabama. I'm also the division director of pediatric critical care. So every critically ill child in this state comes to me and my team of doctors, nurses, respiratory therapists. And my first fact is that masks work. And not just the N95 worn perfectly. Many children, unfortunately, we learned were COVID positive after we treated them. There was a child 2 weeks ago that died in this state of heat stroke. And he came to us, and we were all in his face, helping move him, helping to try to save his life. Unfortunately, he died of heat stroke. He was COVID positive. Not a single person was wearing an N95, but every one of us had a surgical mask on because they're required in all hospitals throughout the country. Masks work so well that we have not seen a single child in this state hospitalized with the flu in the last 17 months. That is remarkable and never seen before. And we had only 5 cases of RSV in March. The entire winter, RSV disappeared. And as soon as masks went away in April, RSV came roaring back. And we've now had 295 cases of RSV, and luckily today we're down to 2 cases of RSV. COVID, on the other hand, has gone up and up and up. Unfortunately, we never know when we're going to get exposed. And I've changed the child's name, but Heather was born 4 days after Memorial Day, and her family, like many of us, attended a Memorial Day celebration. She was born on Thursday. Dad and brother started feeling sick, tested positive on Saturday. Mom left the hospital learning that her entire family was positive. And on Sunday, that little baby at 5 days old came to the hospital and needed to be put on life support because she too contracted COVID. At the time, she was the youngest person in the world to receive remdesivir, which hopefully helped save her life. And today she's doing well, but we never know when that exposure is going to occur. And that's why universal masking is so important. My second point is this variant of COVID is the most infectious virus respiratory known ever. In a room of 10 people, more than 7 of us will get COVID from the Delta variant. This is about 3.5 times what the other variant is. When this goes away, I'm all for getting rid of masks. I hate them as much as anyone else. But right now is not the time to do that. You don't have to be perfect to wear them for them to help prevent. And finally, my very last point is that the vaccine is coming. Most pediatricians out there expect the vaccine to be approved for 5 to 12-year-olds in the next 3 to 4 weeks. Very soon, elementary school kids can start being protected. Right now, without universal masking, we are exposing unnecessarily kids to this variant that is highly contagious. And whether it makes kids sicker or not really isn't the point. The more kids that get it, the more likely you are to have hospitalizations. To date, we've had 650 children in the hospital at Children's with COVID. We've had 6 children die of COVID, many of which you don't know about because we can't share that information with you. Kids are getting sick, kids are dying from COVID, and most luckily are not. There's over 25 million children in America who've lost a parent or both parents to COVID. So this is real, it's affecting children, and we can help prevent it with universal masking, at least until the Delta variant gets better and vaccines are more available. Thank you.
Thank you very much, Nancy.